This is Caring for Kids on News Talk 760 WJR. Presented by the Children's Foundation. And here's your host, President and CEO of the Children's Foundation, Larry Burns.
Well, thanks, Mark, and hello, everyone, and welcome to our August 2021 edition of Caring for Kids. Tonight's show, we have a great lineup, as usual. Joining us will be Ida Benson of Covenant House, Michigan, Tom Rich of the American Cancer Society, and Mark Ralko of Inclusively Fit. It's all coming up next on Caring for Kids, here on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
Welcome back, everybody. Welcome to August edition, Caring for Kids on WJR. And I want to welcome Ida Benson. Ida is the Director of Development and Communications for Covenant House, Michigan. Ida has 25 years experience in major giving, capital campaigns, marketing, team building, and foundation and corporate relations. Ida is a longtime member of the Association of Fundraising Professionals, as well as a frequent public speaker to local networking groups about fundraising and nonprofit management. Ida, welcome to Caring for Kids. So Ida, give our listeners a general overview of the Covenant House, Michigan, and some of the main strategic priorities that you're facing now in the organization.
So thank you so much for having me this morning. Covenant House, Michigan provides youth-facing homelessness with shelter, education, and vocational programs. We'd like to build a bridge to hope for young people facing homelessness and also survivors of trafficking through unconditional love, absolute respect, and relentless support. Our doors are open 24/7, and our programs are designed to empower young people to rise and overcome their adversity today and in the future. And in this time, especially in COVID-19, we have found that housing is definitely healthcare. The last 18 months have been extremely hard on youth who have been unsheltered. They're not feeling safe at home, so they're finding themselves on the streets, which is this, homelessness can be an endless cycle. But right now, we are finding that youth are not being vaccinated, they're not taking care of themselves, and they're winding up more on the street. So Covenant House, Michigan wants to be that space for youth who are facing this adversity to come here and find out what's going on in their lives. So it's not just, a bed and meals and clothing. It's a completely way to change how they think about themselves and their lifestyle. Homelessness interrupts their progress toward adulthood and, a future of independence and self-sufficiency. A lot of our young people have never had that parental figure guiding them. And at 18, they're kicked out of the house and they have no idea what to do. So Covenant House, Michigan provides that structure and that stability and moves them on that bridge toward giving them an idea of what they want to do with their own lives.
Great. And we're talking with Ida Benson from Covenant House, Michigan. And homelessness for anyone is terrible.
Sure.
But particularly young people. And how does that happen? What are some of the causes that you're aware of that causes that?
Yeah. So interestingly, most of young people on the streets across the country, especially in Michigan, do not choose to be homeless. They are out of, they come into homelessness of no circumstances of their own. They're kicked out because they come out as LGBTQ. They're kicked out of their house because they're having a mental crisis. Mental health usually rears its ugly head between the ages of our young people, 18 to 24. So if a young person is having depression or they're having anxiety or they're having a schizophrenic breakdown and they don't have any kind of adult or someone who's helping them, leave. We don't know how to handle you. So they're out on the streets. They have issues with a parent's new significant other where they're not getting along. They have issues with siblings. So instead of trying to work through the issue, just leave because we don't know how to handle you. So our young people are not, that we like to say the least interesting thing about them is that they're homeless because that's not who they are. They are, they want to be doctors and lawyers and they want to drive a truck and they want to work in a factory and they want to do something with their lives. They just happen to find themselves unsheltered.
Yeah, that's terrible. Talking about mental health, as hopefully our listeners know by now, that the Children's Foundation has a major focus on mental health in young people, from preschool youngsters through grade school, high school, and college and beyond. And earlier in the interview, you mentioned COVID. We've all lived with that for way too long. And so what are some of the things that you and your colleagues are seeing as it relates to young people struggling with mental health?
So approximately 60% of our young people who enter Covenant House, Michigan, are suffering from untreated mental illness.
Mm-hmm.
And that in addition, they have a co-occurring disorder, which means they're not only having mental health issues, they're having substance abuse. Because if you're unmedicated and you're having anxiety or you're hearing voices, what's the cheapest and easiest way to help quell that is to look at substances, marijuana, alcohol, anything that's on the streets will help you feel better. So our young people are coming in with all this untreated. They need to get sober and they need to get their mental health together. So we have seen over this last, I would say 4 or 5 years, such an uptick in the youth that are entering our shelters with this co-occurring disorder that we started a program called House of Hope, which the Children's Foundation of Michigan has been wonderfully and just gave us a fantastic grant to help continue this program. So youth who have co-occurring disorders are put into more or less a day program, and they're taught how to deal with not only the issues that led them to be unsheltered, but their mental health and their substance abuse. We work with partners across the spectrum here, across the street at Salvation Army, to work on their sobriety, to make sure that they are going through either a 12-step program or something where they're taking a hold of trying to get sober. And in addition, we have social workers on campus and also through another one of our partners to help work on their mental health. And that's getting them medication if so needed, and getting them into talk therapy to work on how they're feeling around this. So when they are moved out of the shelter, when they move to the independent living, they can continue with their sobriety and their mental health, because that is sometimes one of the issues, as I said before, that leads them to the streets, that leads them to be unsheltered.
Yes.
So, through grant monies, we've been able to continue this program of helping those on the streets who really need it.
Great. And we're talking with Ida Benson from Covenant House. Can you say that diagnosis one more time?
Co-occurring disorders,
Okay.
right?
I had not heard that before, so.
Right. And by treating both the addiction and mental health, we tend to address each of our young people's unique, relapse triggers, such as depression, mood swings, or panic attacks,
Yep.
As well as, strengthening their critical ability, to overcome their illness and to move into sobriety.
So you mentioned the Children's Foundation grant,
Mm-hmm.
and we're very proud of that, and we're delighted, and we're just getting started, hopefully. So tell our listeners about not the grant, but more importantly, the program that it's supporting. A little bit more detail.
Sure. So during the intake process, our residents are assessed for both their physical and mental well-being, as well as substance abuse. And if those medical and substance abuse services are needed, beyond our scope here, we refer them to our outside. We have a mental health partner with Central City Integrated Health, through a combined partnership and again with the Salvation Army to work on their mental health and recovery. Our staff works together to develop a treatment plan, which includes those goals and steps needed to accomplish those goals. And based on those needs identified in their plan, the residents try to identify which life skill classes that we offer here are most beneficial to them. So things like how to manage a budget, how to work on your anger management, how to look at trauma-informed care, because a lot of our young people do come from a place of trauma, a place of sadness. And if they can get a handle on that as well, it helps in their recovery. And so the development, life skills, forms a cornerstone of this program, because as our youth complete these trainings, they can develop these tools that are critical for self-sufficient, healthy living and able to manage independently on their own. I also want to talk about our occupational therapy. We do have an occupational therapist along with mental health and support services. So a lot of the daily living skills, things like housekeeping and cooking and how to drive a car and personal appearance and hygiene, educational planning, job seeking, job maintenance, emergency skills, how to change a flat tire, these kind of things that when we were all growing up, our parents or parental figures taught these to us. So the occupational therapist is working with our young people to try and do these basic living skills that they may not have had growing up.
Yeah. Well, what's on the horizon for Covenant House? Anything that you're particularly looking forward to?
So we are looking forward to having our in-person special event, Sleep Out Executive Edition, on November 18th.
Great.
That is crucial funding for us. That is a fantastic event where sleepers, it's part of our national organization, it's the National Sleep Out, and they will come onto campus. Hopefully, that's our plan right now, to come onto our campus in Detroit and really experience the programs that we offer, get a chance to talk to our young people, and sleep outside on our basketball court to raise funds for the organization. It's one of our largest events. So we're really looking forward to having that in person.
So if somebody wants to get involved with that or just support Covenant House Michigan, how do they do that?
So you can go to our website, covenanthousemI.org, and you can also go to our Sleep Out site, which is sleepout.org /event/Michigan, and you can register for the event.
Great. Well, thank you, Ida. Thanks for all you're doing, helping these youngsters, particularly during this COVID time that are struggling with their situation and making it better and giving them hope. So thank you for all you're doing.
Thank you, and thank you for having me on today.
It's our pleasure. And next, we're going to talk to Tom Rich about his work at the American Cancer Society when Caring for Kids continues, right here on the great voice of the Great Lakes. News Talk 760 WJR.
Welcome back to Caring for Kids on WJR, presented by the Children's Foundation.
Okay, welcome back, everybody. Larry Burns here, Caring for Kids. And here with me now is Tom Rich. Tom has 16 years experience with American Cancer Society, working in cancer control, focused on prevention and early detection. Tom has his master's in public health with a concentration in epidemiology, and he is a member of the board of directors of the Michigan Cancer Consortium and chair of the evaluation committee. Tom is also an adjunct faculty member to the University of Southern Indiana, where he is teaching courses in public health. Tom, welcome to Caring for Kids. So Tom, first let's start off with, how are things in general at American Cancer Society? You have a great brand name. Everybody is familiar with your name and the organization. But give us an overview of some of the current priorities that you're now dealing with.
Well, you're right, Larry, that ACS is recognized as a leader in all things cancer. I don't think our priorities have changed drastically. I mean, our overall priority is to reduce the cancer burden, but COVID has certainly put a rush on some of those priorities. So cancer screenings. We know that during COVID, that cancer screenings weren't happening on the basis that they normally would. So there was a big decrease in those cancer screenings, and understandably so. People were frightened about going into a clinical setting to be screened. The clinic itself was experiencing other priorities and staff shortages. So ACS right now is focused on this return to screening. And the National Cancer Institute anticipates that we're going to have 10,000 additional deaths by 2030 just because of this delay in screening. And as we all know, that the later a cancer is diagnosed, the treatment outcomes are worse. So that's been a big priority for us right now. Along with that is getting the HPV, the human papilloma virus vaccine. We've now connected 7 different cancers with HPV. If you would have said 30 years ago that we had a vaccine to prevent cancer, people would have been knocking on the door to get this vaccine. Now, as you know, people are eager to get any kind of vaccine. So we're pushing that. Tobacco, we know tobacco has a link to about 40% of cancers. So to educate people on the use of tobacco, to focus on legislation that limits where you can smoke, who can smoke, the proliferation of vaping products, especially aimed at children. So that's always a big concern. Health equity. We know that, unfortunately, your zip code is more important than your genetic code when it comes to to diseases. So, what can we do for those social determinants of health to make sure that everybody, when they're diagnosed with something, has the same treatment available and the same treatment outcomes? Again, advocacy is always a big thing for us. Patient services, this is another one of the things that we do that has been limited by COVID. Our road to recovery, where we would take patients to their treatment. We can't do that right now because of COVID. And then research, always research. What are those causes of cancer? What medications are there that we can use? So, again, we're kind of doing the same things. There's just more urgency to it at this point.
Thank you. And we're talking with Tom Rich from the American Cancer Society. And as you mentioned, all of those priorities, they're very similar to the Children's Foundation, particularly when it comes to the social determinants of health and equity in healthcare. So it's music to my ears what you're doing, and you're doing great work. So tell us about the Gold Together campaign. I was not familiar with that, but I'd like to hear more about it, and I know our listeners would like to hear more about it as well.
Yeah, Go Together, we started this back in 2014, and it was a part of our Relay for Life. And Go Together is really an effort to raise money exclusively to address childhood cancers. Last year, we've promoted it more, and we've started a campaign especially around Go Together. So we've taken it out of the Relay venue and gave it its own platform. In fact, in September is the time that we are making a big fundraising effort through Go Together. And we have a wonderful volunteer base. And so we ask volunteers to sign up to raise money for the Go Together. And if they're passionate about childhood cancers and they want to get involved some way of adding to this, then we encourage them to become part of the campaign. You can go to cancer.org, which is our website. So cancer.org, and then /Go Together. And there's more information there.
Great.
But again, it raises that money addressing those childhood cancers of research, education, advocacy, and program services. So far, since 2014, we've raised $2.5 million just on that campaign. And we have high hopes that as we make it its own separate campaign, that dollar amount will increase significantly.
Great. Well, the Go Together campaign sounds like something right up our alley as well. So we'll find out more about that as we move along. And in the intro, when I introduced you, I mentioned that you're involved with the Michigan Cancer Consortium. And so
correct.
What is the consortium all about, and who are some of your partners in that role?
Well, the Michigan Cancer Consortium has been around for 24 years. So it started in 1997. It was a grant from the CDC given to states and tribes to come up with a cancer plan and to really have a place and an organization where different organizations within the state that are concerned about cancer can be a part of, and then together draft this cancer plan that we ask the organizations to follow, and kind of a blueprint too for the whole state of these are the things that we want to focus on. We have 5 main goals. Our cancer plan for 2021, we've completed that. We hope to announce that, make that public in the near future. It is available online at michigancancer.org. But there are 5 main goals, and that one is to promote health equity. So as you and I were talking about a couple minutes ago, then there's to prevent cancer. So how can we prevent cancer from occurring? How can we detect cancer at its earliest stages? Diagnostic and treatment. So what are those most effective and appropriate methods to treat cancer? And then the quality of life of someone with cancer. How can we optimize their quality of life and services to those? The consortium itself currently, there are 93 different organizations that make up the consortium. These are hospitals, these are health plans, these are county health departments, these are member organizations. We would love for you and your group to become a part of the Cancer Consortium.
Sure. Let me know how that can happen.
Okay, I certainly will.
Yeah, as you may know or may not know, that one of the focus areas of the Children's Foundation continues to be pediatric research, and cancer is clearly one of those priorities. And we just funded for the last 3 years some genetic research at U of M, Children's Hospital of Michigan, Mott, Wayne State, Hurley Hospital up in Flint. So we're very dedicated to pediatric cancer research. And a lot of people don't know that right now in Detroit, the Children's Foundation is the largest provider of pediatric research, particularly at Children's Hospital of Michigan. So we would love to find out how to be part of the consortium and health equity. You mentioned, and we're talking with Tom Rich from American Cancer Society. We're funding a project right now at U of M that is looking at equity and particularly how physicians deal with different equity situations. And I think we're going to continue that journey with U of M and some others so that it's part of our commitment, as it is yours, to equity, inclusion, and diversity. And so we're excited to continue down that journey.
Yeah, it's interesting that they found that physicians don't always treat people the same, right?
Yeah.
For whatever reason. So we know that's a big part of it. We know that people with lack of access. So if you're in a rural area and you have to drive 50 miles to get treatment or see your provider and you don't have a reliable automobile or, it's just a long drive, that's something. We know, too, that even with the Affordable Care Act, there are still approximately 8% of Michiganders have no health insurance. And again, we know that health insurance gives people access to treatment, and people that are insured have better treatment outcomes.
Absolutely.
So, yes, I applaud your work and really interested in getting you on in the consortium. I'm on the board of directors. So
okay, so you can get it done.
That we get you in. I can get it done for you.
All right, great. So the other thing I want to mention that you talked about earlier is early detection. So human nature is people are kind of afraid. They're scared to go if they think something might be wrong, particularly men, I'm told. And so this early, go to the doctor, have them check it out, because if you do have cancer, you have a much, much, much better chance of taking care of that if you take it on early. So don't be afraid. Go to the doctor and check it out. Would you agree with that?
Oh, absolutely. And people come up with all kinds of excuses. It could be, well, I'm healthy.
Or I feel fine.
I feel fine. Or even if I go to the doctor and am diagnosed, I can't be away from my family. My family depends on me. And, they don't take that to the logical conclusion that if you come down with cancer and you pass away, then your family's going to be without you. One of the things that the American Cancer Society has done in association with other organizations is put together focus groups and find what messages resonates to different groups of people. So with the National Colorectal Cancer Roundtable, we did these panel groups and we divided them. We found like 5 different messages that resonated with the entire population, that study population. But when you broke these down by newly insured or people who thought they were well and other different groups, you found different messages resonated with them more than somebody else. And so it's that kind of research and looking into that to better motivate people and find what that's going to be to make them go and get that cancer screening.
Right, exactly. Well, Tom, I could talk to you all day about this important topic. And so we'll have to join that consortium, and then we'll have you back on Caring for Kids in the future. But thank you for the work you're doing. I'm a big fan of American Cancer Society. When I lived in Toledo, Ohio for a long time, I chaired a golf outing for American Cancer. My employer, the University of Toledo Medical Center, is a recipient of American Cancer Society research funding. So I'm a big fan, and now I'm a big fan of Tom Rich from American Cancer Society.
Oh, well, thank you. And Larry, we appreciate what you're doing with childhood cancers. Nobody really knows what causes them. And we appreciate what you are doing and the money that you're putting into the research of the causes and the treatment of these childhood cancers. And, with your influence, please encourage people to go to cancer.org/Go Together and find out about our Go Together campaign.
Go Together, absolutely. We will do that on the Caring for Kids site, and we'll get the word out.
Okay, thank you so much, Larry.
All right, thanks, Tom, and I look forward to the consortium, so don't forget about me.
Okay,
all right.
That will happen. Thank you.
All right,
Bye.
Thank you. That was Tom Rich of the American Cancer Society, and next we're going to hear from Mark Ralko of Inclusively Fit. And that's when Caring for Kids continues. So don't go away. We're here on WJR.
Welcome back to Caring for Kids on WJR. Presented by the Children's Foundation. Once again, here's Larry Burns.
Joining me now is Mark Ralko. Mark serves as the executive director of the Inclusively Fit Foundation, a role he has held for 5 years. Mark graduated from Eastern Michigan University in 2010 with a degree in special education, cognitive impairment, and adaptive physical education. Mark's focus is bringing awareness to the importance of health and wellness to the special needs community in our state. So, Mark, welcome to Caring for Kids. It's great to see you again. It's been 3 years since we met.
3 years.
Thanks for coming into the studio.
Thank you again for having me.
You're most welcome, and you're doing great work. And I mentioned a couple of years ago, maybe 3, Dave Coulter, county executive now of Oakland County, and I visited.
Yes.
And was so impressed with what you were doing. But you weren't a nonprofit. So
we were a for-profit at the time.
Yeah, so we weren't able to help you then.
Right.
But one of our last comments to you and your dad
Yes. Yep.
was, maybe think about becoming a nonprofit. And lo and behold, here we are. You did it.
3 years later, huh?
You did it.
We did it. We did. We listened to you, Larry.
Well, very few people do.
And I want to thank you and your entire organization for getting us in that direction. And so far, we've done some wonderful things as a nonprofit, and you're definitely a person I definitely want to thank. So
You're welcome. And, sometimes people don't realize nonprofit status.
Yes.
You're still a business. You're
Right.
still trying to make things work financially. Otherwise, you can't do it.
Right.
And so great. So it makes me very proud that you did that. And
Yes.
So thank you. And
Yep.
so
Thank
now
you.
we're going to talk about what you're doing. So
Absolutely. Looking forward to it.
yeah. And so your organization, I love the name, always have,
Oh,
is very strategic
Yes.
in Inclusively Fit. So tell us about the inclusive part of that as it's based on your mission.
Well, first of all, Larry, I've had this idea since I was in high school. I was a junior year at U of D Jesuit High School. That's where I graduated.
Go Cubs.
Go Cubs.
Yeah.
Class of 2005. So all the 05ers out there. But, I started working with people with special needs when I was a junior in high school. I volunteered at my parish, at my church, and tutoring people with special needs. And so right then and there, I knew I always wanted to work with the special needs population, but I didn't know what exactly. So
This is high school.
This is high school,
Gotcha.
correct. And then so right then and there, I knew I wanted to be in the special needs community. So I went to school. I went to Eastern Michigan. I got my degree in special education, cognitive impairment, and adaptive physical education. That's being able to teach fitness, health, and physical education to people with disabilities. And, as I graduated, my first year of teaching, a lot of my students wanted to become a part of the school sports teams.
Right.
Like cross country, track, basketball, soccer. And so they wanted to be a part of it. So every day after school, I would assist these kids on a one-on-one basis. I teach them the whole idea of the sport, proper way to stretch, some very basic things, but most importantly, being part of a team. And so that's where the inclusion comes in.
Right.
And so right then and there, so many parents wanted me to help their kids after school. So an idea came. And so I left teaching 6 years ago, and, I opened up Inclusively Fit. And inclusion was the main idea because everyone's fully included. That's our mission. And regardless of your age, abilities, everyone's fully welcome. So everyone deserves a chance to be fit, but also to be a part of the community.
Yeah. And unfortunately, some of your clients
Yes.
probably wouldn't feel comfortable at a health club in the community.
Right, absolutely. Countless times, Larry, so many people would come up to us, parents, when they come to the gym for the first time and say, hey, my son's being looked at the gym. He doesn't know what he's doing. He doesn't feel welcome. He's got low self-esteem.
Right.
He feels like he's being judged. And so what we do at Inclusively Fit, our primary program is our one-on-one program. And what we do is, I pair up one of our clients with our trainers, and they work out together, and we measure their progress. We develop a rapport with them, develop a good working relationship with all the families. And so it's really beneficial for both sides.
Yeah. And we're talking with Mark Ralko from Inclusively Fit. And so when I was there visiting, you were working with a young man on some walking skills, if I remember correctly.
Yeah, going up and down the stairs.
Yeah.
Yes.
Right. So you have a good memory too.
I do.
So what's a typical session look like as it relates to individual session?
Well, honestly, it's case by case.
Okay.
When a new client comes into the gym, we do a formal assessment. I take them through several exercises, kind of see where he is physically, but also we get to know him personally because, all of our clients have different cognitive abilities. Some of them are high functioning, some of them are low functioning. So we assess their functioning skills. We ask the parents, if they learn by visual, guidance, visual cues, verbal cues, and so on. So not only do we get to know the client from a physical standpoint, how strong they are, how active they are, but we also get to know them as a person as well. So we know how to appropriately instruct and really teach our clients.
And do some parents stay and participate in the session or no?
Absolutely. We have a lot of parents that stay.
Okay.
Parents sometimes are included in the workouts, if they want in on the workouts. If parents just want to go off on their own, walk on the treadmill or do some weightlifting, that's perfectly fine too. Or they can stay in the lobby. We always give that flexibility to parents because, parents with special needs, they go through a lot.
Oh, they do.
They go through a lot day in, day out. And so we want to make sure we're not only helping the client, but we're also helping the entire family as well. That's including parents, siblings, even grandparents come to our facilities all the time. So we really want to help the entire family.
So I don't forget.
Yes.
Remind our listeners exactly where you're located.
We are located in Sterling Heights.
Right.
We've been operating for 5 years now. We just celebrated our 5th year anniversary this past July. So
congratulations.
Thank you so much. It's been a wonderful 5 years. I just love, helping people with special needs and really getting out into the community and helping these people.
Do. So the Children's Foundation, you became a nonprofit.
Yes.
Then we could say, okay, Mark, we can help you.
Yes.
So we just made a grant. Tell us about that grant.
Thank you again, Larry, for the wonderful contribution. It's going to go a long way in helping our clients in the special needs community. With the pandemic here, we really wanted to know how we can really expand our business and what can we do to really help these families.
Right.
Because these clients have been going through, so many things, during the pandemic. We've seen depression issues, we've seen a lot of weight increase. And so what can we do differently to really help our business? And so with the contribution, what we're going to do is we're going to do a couple things. Number one, we're going to start at-home training.
Okay.
Kind of do some at-home stuff because, a lot of families are still nervous about getting out into the community with the pandemic because a lot of our clients, they have, don't have the best immune systems and they may be susceptible for more illnesses. So anything we can do, we're going to definitely help. And so we want to do at-home assessments. We want to do at-home training. And because a lot of our clients only come to the gym once or twice a week, we want our clients to be doing something every day.
Okay.
And so we want to assess what we can do at home with them. And so we will be able to help assist in purchasing at-home equipment for them, whether it be, dumbbells, medicine balls, even treadmills. We can definitely help in making that contribution. And also, too, I have a degree in special ed, and a lot of my staff, have exercise science degrees and personal training credentials. So what I want to do is I want to further their knowledge in the special needs community. So that's what we're going to do with the contributions as well.
Great. Well, hopefully it's just the start of our relationship.
Absolutely, Larry. Looking forward to this relationship.
What you're doing is so very, very important. So if there's a family out there listening to this and they want to get involved, they want to become a client or a member, how do they do that?
You can call the facility at 586-850-5004, or they can visit our brand new website.
All right, brand new
website. Yeah, it just got done this past fall. And so, it's been up for almost nearly a year now. It's www.inclusivelyfit.org.
That's easy to remember.
It's definitely, try and make it easy for everybody, Larry.
So, Mark, what else do you want people to know about what you're doing and at Inclusively Fit?
Honestly, Larry, we see some amazing things. We do our one-on-one personal training program, but we also do a buddy workout system to really promote socialization, so it's 2 clients with 1 trainer. Like if two people at the gym meet each other and they become friends, they can work out together with a trainer. With us giving, the clients equal amount of attention, and still a good amount of attention, but they can promote that socialization. So, they can boost their self-esteem, their self-confidence, and, feel really a big part of the community. And so we have that. We do a lot of we're going to start doing field trips again, having school districts come back to the gym, post-COVID and everything. So we really want to, get as many people in the gym as possible.
Right. And about how many clients do you have now?
We have over 100 clients.
Over 100.
Yes.
So I'm just thinking out loud here, but the Children's Foundation now runs the First Tee for Greater Detroit, including Macomb County.
Yes.
So we should think about, is there something with your clients that we could do with First Tee? So let's give that some thought.
Yeah, absolutely. Definitely will.
So, one of the things I'm trying to encourage, particularly with kids, are so much more adaptable than adults.
Yes.
And I've seen where if a youngster that is not struggling with a disability interacts with youngsters that are, they become extremely comfortable with each other.
Absolutely. So it's a win-win for both sides.
So the staring goes away, whatever.
Because
and so if we can integrate some of that, maybe.
Yeah. Because, children without disabilities, they'll get that exposure and they'll get more experience with people with special needs. And they'll learn a lot too. So it's beneficial for both sides.
And as they grow older, they are just that much more comfortable interacting with people that look or act differently than them. So
exactly. With our clients, Larry, we see a transformation, not only physically, but, from a personality standpoint as well. Their self-esteem is boosted. They're more self-confident and they want to go out and do more things. Like I've had several clients come up to me and say, hey, Mark, because of your hard work and the hard work of your staff, my son wants to be a part of the track team. Soccer team and Special Olympics. They want to do those things. So, we want through fitness and health and exercising, we want them to be a part of everyday inclusion, and that's the community.
Great. Inclusively Fit. That's the name. So, Mark Ralko, thank you for all you're doing. And,
thank you, Larry. I appreciate that.
We'll catch up less than 3 years. So that I promise.
Hopefully it's a lot sooner than that.
Yeah, absolutely. So, thanks a lot.
Thank you so much, Larry. Take care.
You're most welcome. Next, I'm going to provide a little bit of an update on the Children's Foundation. And it's all going to happen here in 1 minute, here on the great voice of the Great Lakes, News Talk 760 WJR. Welcome back, everybody. Larry Burns here, winding up another Caring for Kids August edition. Thanks for joining us tonight. The Children's Foundation continues to be very active this summer. Looking forward to a great fall. And earlier this month, we held the very first Ben Hogan Championship of Michigan that benefits First Tee Greater Detroit, our sister organization. And we were able to raise over $100,000 net this first year of our event. So many thanks to our sponsors, many thanks to the Ben Hogan Foundation folks, and we're looking forward to next year already. And thank you for helping us each and every day at the Children's Foundation as we continue to be on the move. We'll see you next month on Caring for Kids.
Caring for Kids with Larry Burns on WJR has been presented by the Children's Foundation.